I will start this video with a simple and alarming thought about the development of dementia. Dementia, which develops in many patients at 60 or 65 years old, actually begins much earlier. The processes of change in the brain begin long before, 15 or even 20 years before, the moment when a person suddenly starts getting lost in their own building, stops recognizing loved ones, keeps repeating the same phrases in conversation, and returns to them every minute. When relatives of patients come to me and say, "Save my mom, my dad, they've stopped recognizing us, they're doing things in the bathroom like looking for food there and drinking water from the toilet," and this is not a hyperbole. And in the kitchen, they're relieving themselves or have already blown up the kitchen by forgetting to turn off the gas. It all started earlier. 15 to 20 years before that, changes in the brain began, and this is confirmed by research. These aren't just some inventions of mine, these are facts. A very serious study was published in the Lancet journal in 2024. Amyloid and tau proteins start to accumulate not at 65 or 70 years old, but as I already said, significantly earlier. That is exactly when the changes occur, the first changes in the brain. And the paradox is that very many people believe that dementia is a disease of an old person, an elderly person, and at 40 or 45 years old, they don't think at all about the fact that, one needs to prevent what will happen later in 15 or 20 years. In general, well, it's understandable after all. Dementia is the lot of elderly people. That's when everything will be bad for them. You need to think about what will happen to you right now at 40. So, a very important thought that I want to convey to those who watch my video to the end. It is important to think about your future today, right now, to think about what will happen to your head, to your brain in 15 or 20 years. I am Professor Eduard Yakupov, a neurologist with over 35 years of experience and the founder of Professor Yakupov's Neuroclinic. Today, I will talk to you about this very relevant problem. And what should you do at 40 or 50 years old to keep your memory intact and your brain flexible? Today we will talk about preventive measures based on modern medical and scientific data. And before I tell you about life hacks, what to pay attention to, and so on, I will talk about the basis, the foundation, cognitive reserve, but not about the scientific concept with formulas or some scientific calculations. Imagine a library. Just imagine that your brain is a library with shelves and books. Every year of your life, you put a new book there. You learn something new, a new book, a new skill, and new books, new shelves appear in your library. And it depends only on us how big a library we have in our heads. And now let's imagine that a fire breaks out in the library. If the library is very small, with very few books in it, then all these shelves will be instantly burned down by this fire in an hour. If you have a powerful cognitive reserve, will any processes that occur, adverse processes that arise in your brain, whether it's a hypertensive crisis, stress, psychological trauma, or a traumatic brain injury, have an impact on your brain? Yes, of course. But the cognitive reserve is huge, and this will allow you to maintain a clear mind. That is roughly how the concept of cognitive reserve works. This is, of course, a very simplified version. When a person develops dementia, it has many underlying causes, including, by the way, genetic causes. And when people write to me on my YouTube channel saying, "Oh, this person worked their whole life," or an actor who memorized huge amounts of text and then bam, they have dementia. Well, for example, Bruce Willis, right? But there, a genetic problem arises that medicine cannot fight. It is powerless. And now I will start with scientific data and scientifically based recommendations. But let's start with the basics, which might seem absolutely banal to some. First, how to improve your cognitive reserve. Books, reading books. Please don't switch channels. A large study conducted using functional MRI proved that if a person reads serious literature, intelligent literature, their cognitive reserve develops. Moreover, positive changes occur in the brain, which, I repeat, have been proven using functional MRI. But it is very important here that a person reads serious literature, intelligent literature. And I get asked the question, what are intelligent books? What is that? And some people start talking about it with mockery. Let's figure this out as well. In general, reading itself is a useful thing, right? But let's break it down. So you're reading some lightweight novel, something empty, some little detective story or a romance novel. It seems like the brain is working. There have been studies on this topic too. It is working, your vision is working, the text comprehension system is working. But when you start reading serious literature, digging into this text, figuratively speaking, you start thinking about this text, it evokes emotions and thoughts in you. This is a completely different level of brain activity. This is confirmed by one of the studies conducted by Stanford University on this topic, which proved that many more areas of the brain are activated when reading serious literature. But what should you read? Of course, first and foremost, it's the classics. That means Bunin, Chekhov, Tolstoy, Bulgakov, Shakespeare. If you pick up Shakespeare's sonnets or his King Lear, Macbeth, you realize that this text, even in translation, in a good translation, is not just difficult to read. You have to really think it through. If you pick up Bulgakov, it's the same thing, or Chekhov, or Tolstoy, or Dostoevsky. These are complex writers for some, and for young people, it's generally a long read, where they think, why read this? I'll just look something up on the internet. That is a big mistake. At that moment, when you start, as I already said, to dig in, to read into this text, a load is placed on the brain. And this is a very important moment. If you are reading a text and mindlessly flipping page after page, and it leaves nothing in your soul, nor in your emotions, nor in your thoughts, then that is a completely different component. But when the text you are reading forces you to either return to a previous paragraph or stop entirely to reread it and really think about what it means, that is precisely when your brain gets hit with a significant additional cognitive load. It becomes much harder to process. This is what is called smart reading, smart literature. And perhaps you won't master this book, you won't read it in one evening. That, by the way, is an indicator because light reading is swallowed up, say, on a plane. An important question is the dosage. How much should you read? How much is enough? But everyone might have their own recipes and limits here. Well, dedicate at least an hour a day to this. To some, this might seem like a lot. To others, it might seem like a little, but if you make it a habit, it's like having a conversation with an intelligent person, for example, in the evening. By the way, evening reading helps improve sleep, and this is one of the recommendations we give in our lectures on our YouTube channel dedicated to sleep hygiene. Instead of holding a cell phone in your hands or watching disturbing news on TV in the bedroom, pick up some calm, intelligent literature. There will be a lot more benefit for your brain, for your sleep, and for your emotions. On weekends, you can read more. Of course, yes, it's like a deep dialogue with an intelligent conversationalist, for example, for about 2 hours. I also want to say a few words about reading aloud. Ryuta Kawashima conducted a study on this topic in 2005. Reading aloud engages several areas of the brain at once. I can recommend reading aloud when you read to a child, for example, a bedtime story with expression. This develops your speech, your articulation. You hear what you are reading. You think about what you are reading. That is, you see, I'm showing on my fingers right now, 1, 2, 3. Many areas in your brain are activated at this moment compared to when you read a book to yourself. And at our clinic, Professor Yakupov's clinic, we have a healthy brain office. We didn't name it that for no reason. And what is very important, the doctors at the healthy brain office work with the patient for an hour, with each patient for an hour. This is the amount of time that allows the doctor to understand what is really happening with the patient and why they are experiencing cognitive impairment. After all, it's not just Alzheimer's disease, right? It could also be hypertension, thyroid problems, and depression, by the way, as well. And so, in order to figure this out, the doctor needs time. In a regular clinic, there isn't enough time for this. Our doctor works for an hour and provides appropriate recommendations, not only regarding treatment and prevention, but also what needs to be done. For example, yes, for this patient, what tests to conduct. It might surprise you, but it is sometimes necessary to check thyroid hormones, B12 levels, vitamin D levels, and conduct psychological tests that will reveal anxiety or depression in this patient. All of this is important for the prevention of cognitive disorders. And now the next aspect, learning and grasping something new and loading your memory. But before I talk about that, I will tell you about a study of London taxi drivers. The thing is, London taxi drivers go through a very tough exam. That is, they have to recall street names or map out complex routes without a GPS, and do it, mind you, from memory. So when they studied the brains of London taxi drivers, the size of the hippocampus was larger than in the control group of ordinary British people. So what does this tell us? It means that constant memory training allows for improving the structure, the organic structure of the brain. Connections improve. And when we talk, for example, about Alzheimer's disease, and everyone says, well, that's it, it's here and it's here, amyloid protein, tau protein appears, there's no escaping it. But if you start learning languages, and this is where we talk about a very important component, then these processes can come to a person later. Let's recall cognitive reserve. The question of language learning is very important. There are impressive studies that show that bilinguals, that is, people who know two languages, have a much better, much larger cognitive reserve. Why? Because there is constant switching happening all the time, the formation of new connections. Now, if a person, by the way, and it's not just Alzheimer's disease that causes cognitive disorders, for example, a traumatic brain injury or a stroke, and a certain area of the brain gets damaged, the brain has the ability to switch connections, to form these new synaptic components with each other. And in this situation, bilinguals feel better. And it is important that this can be done not only in childhood. You all probably would like or want your children and grandchildren to know several languages. But if you learn it at a mature age, that is wonderful, because it provides food for your brain and develops your brain. In 2012, a study was conducted on Swedish translators. That is, these are people of mature age. And it turned out that when they looked at the brain structure of these people, again using functional MRI, positive changes were revealed in the brain, especially in those areas responsible for cognitive processes and memory. But it is fundamentally important that language learning, just like reading, is a sequential process that requires, well, let's say time, and not just time where you sit down on a Saturday and study. 20 minutes every day, today, tomorrow, and so on. You are constantly learning new words, working with a tutor, and so on. That's when the brain develops, not when you work with some foreign text once a month. And it is also important, of course, to learn something new. In general, for the brain, learning something new. What does this apply to? Please, any motor skill. I can say that both learning and practicing music or dancing also affect the brain. A 2021 study showed that if a person listens to music or plays music, their brain also changes in adulthood. It's understandable in childhood. They took 3 groups. One group did nothing. The second group of mature adults only listened to music. And the third group started practicing and taking piano lessons. So the best results were found in those who both listened to music and practiced the piano. Good results were also seen in those who just listened to good music, again, music. That is, it's not pop music, it's not some kind of carefree, rowdy tune. It's music that makes you feel and think. And that, once again, is classical music. That is, a fundamentally new activity is critically important for your brain. Now, I am very often written to, I solve crosswords, Sudoku, I am loading my brain. I, unfortunately, am forced to disappoint you. In this case, the brain is receiving specific information. That is, in this case, or rather, your brain is developing a specific type of activity, solving crosswords, solving Sudoku. But this is a repetitive type of activity, which, unfortunately, studies have been conducted on this topic, does not show that a person's cognitive reserve improves. In other words, well, novelty is important for the brain, I repeat again, and not just some kind of activity where I flip through the pages of a magazine and do this constantly day after day. The same magazine, or solve Sudoku, 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 crossword, crossword, crossword. But if you ask me as a neurologist, based on my work experience, on the literature, what has been read, studied, and so on, what helps the brain the most is physical activity. In 2024, there was a publication in The Lancet with a meta-analysis, a large meta-analysis, which showed that low physical activity is a direct path to dementia. And this is not so much related to the fact that during physical exercise, blood rushes to the brain. Not at all. The thing is, physical exercise, regular physical exercise, we'll talk about which kind a bit later, actually develops the brain itself. Synaptogenesis increases in the brain and neuroplasticity improves. This BDNF factor, yes, the brain-derived neurotrophic factor, it is very important for cognitive functions. It is at a completely different level in those who regularly perform physical exercises. Now, what kind of physical exercises? What should you do? Everyone chooses something that works for them. One person walks, another runs, someone else does morning exercises, Pilates, yoga, and so on. Here is a very important point. 2 years ago, I recall, 2 years ago, there was a very large European Neurological Congress in Helsinki. I was listening to a speaker who was talking about the fact that you don't necessarily need heavy physical exercise, and there is a concept called forest bathing. That is, it is enough for a person to walk at an average pace in a park twice a week. And here I will immediately clarify, there is the time for cardio workouts, cycling, elliptical. It is very important, yes. I would recommend that people of mature age who have joint problems and, for example, excess weight, not use a treadmill, no, not even a bicycle, but get on an elliptical. There is no load on your joints there, and a gentle cardio workout occurs. This is important. But the second very important block is to still include, even if minimal, strength exercises. The thing is, with age, the phenomenon of sarcopenia occurs. That is, a person begins to lose muscle mass, and you should have at home, if not a barbell with giant dumbbells or kettlebells, then at least these elastic bands that will provide additional load on your muscles. Why is this so important? There are studies showing that every 10 years results in a loss of 5% of muscle mass. And by the age of 70, a person can lose, mind you, up to 30% of their muscle mass. That is, you can lose such a gigantic volume. And after all, muscles are not just, biceps or what you might call meat in quotes, but an active organ. And it has long been known that if a person engages in physical activity, they produce anti-inflammatory cytokines, which, by the way, help fight not only cognitive disorders, but also pain. This has long been proven. These large-scale studies were conducted decades ago. Some might be confused, and others might be indignant. But I'm a mature person. What dumbbells? What kind of strength training? Just do simple exercises. A plank, even for a short time. Lunges, wall push-ups. By the way, we have a separate video on this topic on our YouTube channel. Please take a look. I provide exercises there that can be done at any age and by anyone, regardless of their physical fitness level. But there are a few more underrated factors that directly affect the flexibility of your brain and your cognitive reserve. The format of this video doesn't allow me to cram everything in at once, so please watch the next video on this topic. And in conclusion, I want to convey to you the main idea that I stated at the beginning. Think about your brain now at 40, 45, 50 years old so that you don't end up with dementia in your old age, because dementia is practically impossible to treat. With medication, we are essentially stopping the progression of the dementia development process. That is the best we can afford. It is practically impossible to cure dementia if we are talking about dementia. Therefore, you need to lay the foundation for your brain's health much earlier. But if you have started experiencing any problems with memory or concentration, and this applies not only to older people but also to younger, actively working individuals, come to us at Professor Yakupov's clinic, because in our Healthy Brain office, people are actively working on this topic. This involves scientific research, which provides answers regarding prevention and suggests what tests need to be conducted and ultimately what needs to be taken in order to prevent any serious problems for yourself. And perhaps it is not even a problem of dementia, but rather a problem of depression or some kind of metabolic disorder. The specialists at Professor Yakupov's neuroclinic will help you figure this out.